What's the difference between type 1 and type 2 diabetes? Hey there, welcome to the Diabetes Revolution. I'm Jared Linder, and today we're clearing up one of the most common points of confusion for newly diagnosed diabetics, the difference between type 1 and type 2 diabetes. Well, let's break it down. So, type 1 diabetes is an autoimmune condition where the body attacks and destroys insulin producing cells in the pancreas. It usually is diagnosed in children and young adults, but really it can occur at any age. And it requires lifelong insulin therapy. Now, type 2 diabetes is quite different. It's a metabolic disorder where the body becomes resistant to insulin or it doesn't produce enough. And it's more commonly diagnosed in adults, but we're seeing it more and more in children and in teens. Now, historically, type 2 diabetes has most often been addressed by trying to manage the symptoms of the disease using medications and sometimes insulin. But over the past decade, more and more research has come out in support of lifestyle changes that actually have the potential to stop diabetes in its tracks, and sometimes the disease can even be reversed. So you may be asking yourself, what are the causes and what are the risk factors for type 1 diabetes? Well, while the exact cause is not known, it's believed to be a combination of genetic and environmental factors. It's not related to lifestyle or diet. Risk factors may include a family history or certain genes. What about the causes and what are the risk factors for type 2 diabetes? Well, this develops due to a combination of genetic and lifestyle factors. Risk factors include poor dietary habits, obesity, a sedentary lifestyle, being over the age 45, having a family history of type 2, and people in certain ethnicities. So it's important to note that prediabetes often precedes type 2 diabetes and that this process can go on for decades before it's finally discovered. So you may be asking yourself, what can be done about this? Well, for type 1 diabetes, it requires insulin therapy through injections or an insulin pump. It also requires regular blood sugar monitoring. And due to the complexities of managing type 1, careful meal planning is an important skill. Now, for type 2 diabetes, management often starts with lifestyle changes like diet, exercise, and weight management. All of these play a significant role in treating and possibly reversing the disease. Now, some people may require oral medications or injectable treatments, including insulin in some cases. It's important for type 2 diabetics to get regular checkups and screenings for common complications because diabetics are at a much higher risk for many health concerns. Now, if you're newly diagnosed with either type of diabetes, you probably have a lot of questions. And that's why we're here. And we've created a free 7-day starter guide for newly diagnosed diabetics. It covers everything from understanding your diagnosis to meal planning and lifestyle tips for both type 1 and type 2 diabetes. So visit thediabetesrevolution.com, download your free guide, and start your journey to better health today. And don't forget, like this video, subscribe to our channel for more diabetes management insights. We thank you for watching, and remember, whether you have type 1 or type 2, knowledge is power in managing your condition, so stay informed. Stay positive, and we'll see you in the next video.